Good afternoon. It's December 12th, 2024. I'm Dr. Deuk Majin. We're streaming live spine surgery at Deuk Spine Institute. Our patient is from Canada. He travels here with thoracic pain from 2 thoracic disc herniations already repaired, lower back pain from an L4-5 disc herniation just repaired, and we're going to be performing our final procedure, which is a Deuk plasma rhizotomy. And this is to treat facet joint pain. We've been treating disc pain so far, and now we're going to treat facet pain. All right, Henry, let's show the audience how facet joints become painful in the first place.
Of course.
All right, Henry, now we've looked at why facets get painful. It's an injury to the joint followed by inflammation, and the joint never heals. It just becomes painful. Let's show the audience how we actually fix painful facet joints.
Of course.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Well, you can see the way we treat facet pain, folks, is we basically destroy the pain nerve to the joint. That is the best way to treat facet joint pain. There is nothing better. The alternative would be a fusion of the joint with screws, rods, but that's invasive and totally unnecessary. It accomplishes absolutely nothing better than just the rhizotomy. Okay, we need to lift this up. Henry, let's show the audience the different causes of back pain.
Not a problem.
I'm Dr. Deuk Majin with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously.
All right,
with
sorry I had to interrupt your video, but we're almost done, and I want you all to at least be able to ask some questions and see the second half of the rhizotomy shot. All right, that's going to be my entry point right there, right at the tip of my probe. It's between the two transverse processes, and now I'm going to go in with my probe. The goal here is to destroy two pain nerves. They're called the medial branch of the dorsal ramus. Wait. Shot. And they run, I'll show you where they run. Jordan actually will show you where they run. Jordan, show us where the first one that we're going to attack is running. Shot? Yeah. So I'm just a little bit north of where I should be. North means towards the head. I need to be a little bit south and right on that bone. And that's where I am right now. Shot? Yep, a little bit too medial. I'm going to go a little lateral. Lateral is towards the outside, towards the flank. That's too inferior. Try again. All right, there's my probe. Probe is in the perfect spot right there, and that's where that pain nerve runs. So I'm destroying it as we speak, transecting it. And we do that with a wanding technique using radiofrequency energy, but this is not a radiofrequency ablation. It's called a rhizotomy, where you cut through a nerve. See a little vapor there, a little steam basically forming at the tip, making that little white mark. That's how much energy we're delivering, and that is the plasma. High energy electrons in water vapor. Plasma. Shot. Now you can see his transverse process on that side that I'm on is abnormal. It's not a normal TP. It's a big one. Much bigger than it should be. Shot. But it's not a problem. That is not going to cause any issues for him in his lifetime. It's just an anatomical variant, they call it. Shot. All right, the probe is in the perfect spot there at the top of the TP. That's where the nerve runs. We're done. If you have questions, I'll be happy to take them. Any questions?
At this moment, no current questions.
All right. Excellent. I think he's going to do great. Go ahead. All right, Henry, you can end the stream.
Copy that.